Okay, we're at module 3 now. And this is where when you go and you looked at, yes, I have some mechanical issues. I need to address this piece of it. This is the category for you. The majority of the people do have mechanical. That's the biggest category that we see, is that there are mechanics of the back that are problems. And we're going to go into the three most common sources that can create your back pain. And again, make sure that you have your sheet filled out before you go through some of these things, because what'll happen is if you don't, you're going to be confused. You're going to be like, that sounds like me, and that sounds like me, and that sounds like me. And you're going to be really confused because you are emotionally attached to what's going on with your back. And we're not. So that's why also when you get to a healthcare provider that can actually figure some of these things out, we're not emotionally attached to what's going on with your back. So we can go in and figure things out, because we can ask questions and understand. Obviously, we're the professionals. We've seen this 1,000 times, probably more, way more than 1,000 times. So we understand how things work, but you don't. And this course is really trying to help you navigate where the source is coming from. So if you haven't filled that sheet out and you're going and you're listening to some of these things, you're going to think that, oh, that sounds like me and that sounds like me. And you're going to be very confused. So make sure that you write some of the things down on the sheet so that you can take that sheet and now come to this section of it to kind of start figuring out where your pain might be coming from. So, what are the three common sources of back pain? They are the lower thoracic spine. That's where your ribs are. It is actually in your back. There's what we call kind of the disc model. And we're going to explain that a little bit. And you can get pain from the disc, but you also can get pain from nerve compression. And then the hip. And any one of these can refer pain in different areas. Because remember, I say where the site of the pain is often not where the source of the problem is coming from. So we're going to go into kind of where the different areas of the pains are located based on based on each section. So let's go into the lower thoracic problems. These are the lower part of the ribs. Lack of mobility in the lower ribs creates pain in the middle of your lower back, into even kind of the SI joint area. So it's really common to feel pain close to the outside of your hip. So it's like not necessarily in the center of your back, but a little bit more on the outside lower back, kind of where the hip is, kind of like in this area right in through here. Um, you get pulling through here, and you can also get pain in the hip from the lower thoracic spine. It's very, very common. So typically, you do not have much soreness in your lower ribs. You don't even know that that's an area until someone starts working on them. It's very, very, very common. So if we go back in and we look at the anatomy of our back. So we're going to kind of show you again this video, and you can see where the ribs are. Here are the ribs. They tend to not move very well because what happens is we stay in kind of more of a flex posture working on the computer. It gets rounded out. Those ribs start moving out a little bit. They don't come in. And so what happens is we get a lot of protection from the muscles that go from the ribs down into this pelvis. So you can see part of the ribs, they attach into the pelvis, they get tight through here, which then can tighten up muscles into the hip. And so this is why it's really common to see issues in the lower thoracic spine through here, creating issues that happen a little bit more onto the outside, but definitely only on one side of the back. And usually with the thoracic spine, you don't notice it on both sides of the back. That can be a common thing that you'll see in the back. So if we look at the back itself and the disc model, back pain, there are some common locations that you'll see. Typically, you'll feel it in the middle of the back or just to one side. So you may feel like it's low in the back and it's to the right side or it's to the left side. You may feel it on both sides, but typically one side is going to be tighter than the other side, or you're going to have more pain on one side than the other side. The back can also refer pain into the hip, because that's the referral pattern. You can have issues in that disc model that we talked about, where you have pain around those rings and it refers pain into that hip. You can also have pain that hit the disc that hits the nerve, and you can get pain down the leg. And there can be a lot of different combinations here. Common complaints that you see with this: prolonged sitting is painful. You'll see this, it's very common. You'll be sitting and all of a sudden you'll start feeling some pain, or you might feel better when you first start to sit, but then as you move out of that position and you try to stand up, you feel like you're 80 years old. It takes you a while to kind of straighten up. Very common for the back. Typically, walking feels better with something like this, because when you're walking, you're doing little mini extensions. It helps us understand which directions we need to go in with people. Typically, moving feels better versus being in static positions. A lot of times people are fearful of bending forward because that may make their back spasm. These are all common complaints that we see that come from the back, usually. Not always, but a big chunk of the clients, it is coming from the back when they start complaining about some of these things. We'll get into the hip, and that looks a little bit different. But first, I want to go into the disc model so you can really understand what I'm talking about. I'm going to draw everything out for you.
When looking at back pain and how it works, I'm going to draw a few things out so that you get a really good understanding of kind of how it works and how we feel pain. So if we go and we look, this would be like one of our bones for the disc. Here's the disc. Here's a bone. Here's a disc. So this is kind of like our spine. We get the picture. So we have nerves that come off to the side of each, nerves that come off to the side. Let's do another disc up here. These nerves come down and they'll kind of hit here, and they can come down and they'll hit here. So there's two ways where you actually can get some nerve compression, and we're going to draw this out. So if I draw this disc looking straight down in this direction, this is kind of what it looks like. It looks like a little bean. And this disc has rings that go around it. And these rings keep everything intact. And so if I look at this, this is what I would call, this is where the spinal cord is. This is where the thick ligament, there's a thick ligament that just really protects from anything pushing into the spinal cord. And then you have your nerves that are off to the side here. So these would be what these are right here. And then on the top part, this is where the nerve can come down from the level above. So we have the level above, and here's where the nerve comes down. So what happens is inside this disc is sort of like is gel filled, essentially. So this would be the front, just so we know. This is the back. This is the left side. And this is the right side. So when we look at this and we ask, there's a lot of questions we ask. Where's your pain location? And you're saying the majority of it's on the right side. We pretty much know that on this right side, that this is where the problem's going to be, somewhere along this right side. When things are more in the center, it doesn't give us a ton of information overall. But when we know, like when pain's on one side versus the other side, we pretty much know that it's on the right side of your disc. If you have more pain on the left side, you're looking at more of the left side of your disc if the back is the problem. So what happens is we do throughout the day a lot of bending. So if we're putting pressure through this top part of the disc, think of it like a jelly donut. If you push on one end of the gel of a donut, you can move the gel to one side. If you push on the other side, you can move the gel to the other side. So if we're constantly bending forward and bending forward and bending forward, and we come out of those positions and we don't fully recover, and then we go back into bending, which is pretty much what we do a lot. So we are sitting, which is bending. We're bending to clean. We're bending to do yard work. We're bending to pick something up. We're bending as we're sitting on the couch watching TV. We do a lot of bending, and we don't ever reverse those directions. So what happens is the gel starts moving down in this direction. And when it's onto the right side, we're just going to say the pain's on the right side. Then what happens is on these rings, you start getting damage on those rings. So let's say, this is kind of where we have some damage on these rings. Now, you don't have to have pain down the leg for you still to have a herniated disc. You can have pain that's very localized. You can have pain that kind of goes down into the hip a little bit. And that can come from the back. And that's just because we have these rings that kind of get damaged. So how I describe that is, think of like an ankle sprain. If you have an ankle sprain and you put pressure on the ankle, on the ligaments that hurt, it's going to hurt. Does that make sense? So when you put pressure on these rings by doing something in a bending position, it's going to hurt. And all of a sudden, oop, I have pain. Just like if you had a scratch on your arm and you kind of are stabbing the scratch on your arm, it's going to get irritated. If you take the pressure off of it, you can start having healing. The problem is how we put pressure on it is our everyday activities, the things that we do. This is why it's so important to have, to get into your daily lifestyle, because if you don't adjust some of the things that are creating your problems, you're not going to get better. It's kind of like you pull your finger back, you hold it back day after day, year after year, and you can do all the injections and you can do all the soft tissue and joint mobilizations, but if you don't fix pulling your finger back, you're going to continually have problems. So we've got to get into your daily activities of things that are creating some of your issues. And we get into that once we kind of know what direction we need to go into to fix this problem. And we'll talk about that in a second. So that's it. So if we do bending activities, and you start telling me, like, when I sit for a while, it bothers me. When I get up and I start walking, I feel better. Those are, if I'm sitting on the couch, like bending activities, you start noticing that bending is the theme that creates some of your problems. That's where we have to go, okay, it's probably the bending that's going to give us problems. We need to reverse that direction. Walking's little mini extensions. If you say, I feel better lying on my back, again, that's more of an extended type position. And we start seeing patterns that, we need to start moving you into extension. And the reason why is if everything gets clogged down here, where this is where everything is, it's also why when you bend forward, which a lot of times we want to bring our knees to the chest so that we can hold that position, so we can stretch the muscles. The muscles are tight because it's protecting this. This is where some of the problem can be for back pain. And so if you go in, you bring your knees to your chest, it feels better because you open up this space here. But what you're doing is you're putting more pressure up here, pushing everything down in this direction. And then all of a sudden you're like, I'm getting worse. Why is this not getting better? It's also why we've been sitting for a while and now we're going to try to stand up and straighten up. Well, you have all this material that's down here and it makes it hard to straighten up, which is why you feel like you're 80 years old when you go into a standing position if you've been sitting for a while. So that's why this happens. Now, you can have where everything is intact, all the rings are intact, but you get a little bulge through here and it starts hitting the nerve. And then all of a sudden you start getting pain down the leg. Typically, if you get pain in the hip, doesn't mean that you're touching a nerve or that there's a problem there. It's usually below the knee or down and close to the knee and below. You'll have pain down through there. You start asking questions about, is there potentially nerve compression? And we can basically do some testing to figure some of those things out. So those are still very fixable because we've got to do activities where we reverse the direction to start moving in this direction and moving things away. And as we move things away, things will start feeling better. And as we start adjusting some of the things that you're doing throughout the day, you will start feeling better because you'll understand that piece of it. Now, you can damage rings all the way on the side. These all present very differently. I can explain some of them on here, but it gets a little bit more complicated. This is where you really need to go in and get to a specialist to start figuring some of these things out, because this is if you injure yourself here versus here versus here versus here, they're all very different types of treatments that you have to do. And you really need to get into someone that understands if you have some of those issues. And typically, if you are having issues out here, unless it's super irritated, it hurts to sit, to walk, to lie down. You're usually kind of in a rotated type position. Then you start thinking there's probably some issues out and through here. You can get nerve compression even because you can get herniations laterally here that can hit nerves and send pain down the leg. Those are stent. They're very fixable. But you can have it, just so that you know. But this is the model right through here, is really when something is going on with the back. And as you know, I've talked about, you can have issues that can come from the thoracic spine that create this. We're going to talk about that. And you also can get issues in your hip that also can create back issues. But when it's purely the back, there's something, this is the model that we use, and there's things that can go on there. Now, you can get things where you get scarring through here that scar down to the nerve. And that treatment also is very, very different. And typically when you see those is when you've had a herniation and it's come down and touched and attached to the nerve, like you've herniated and hit the nerve, and you started scarring down on the nerve. That can happen with something like that. It has to be around for at least 8 weeks for that to happen. Often after surgery, you have to be careful. That's the other common thing when you'll see like the nerve has been scarred down on, is after surgery. And that's because when you have the surgery, everything's fresh and healing. And if you don't start moving them, and they don't start moving them in different positions, you can also scar down on the nerve. Those are the two most common things: herniation that's scarred down. You don't see those very often. Again, get to a specialist that understands this, because they're going to be able to test you and confirm if that's what it is and if that's not what it is. But just wanted to give you some education around that there are possibilities. Those are very, very, very consistent. Like it's every time I do this. It's not sometimes. I can do it sometimes, and other times I can't. That's going to be something where you have more of a herniated disc, where it's like, I don't understand. Like, I was able to do this one day, but the next day I couldn't do it. That's going to be more of a herniated disc, potentially, if that's where it's coming from. It also can happen with your hip, and also can happen with your ribs, but we'll get into those here in a second. But this gives us a good idea of kind of like a model that you can, that gives you a good, clear picture of kind of what's going on in the back.
So hip problems also can create back pain. We've seen this time and time again. So common locations, back pain will be usually on the same side. Like you aren't going to see this across both sides typically. And you'll also have decreased hip mobility. It's not going to move very well when you bring the knee into the chest. It's not going to move very well when you try to do a figure 4 stretch. It's not going to move very well into like hip extension, where you're really trying to stretch the hip in a backward position. You'll also get hip pain along the piriformis, the IT band. You can get pain on the outside of the knee. And that's just because you are not able to move the hip very well. And you tend to recruit the muscles on the outside of the hip. And guess what? The muscles on the outside of the hip, you start affecting that IT band, and that IT band gives you pain on the outside of the knee. So when we start asking questions on like where do you feel your pain? And they're telling me, it's in my back, but it's not getting better with the exercises that I was doing before. And they are also getting pain on the outside of their knee and pain into the hip. I'm starting to put some of these pieces together going, oh, the hip's not moving. And if you think of like the hip has to move in that joint. And if it doesn't, then the back's going to take over, and it's going to have the back's going to be what's going to be, taking over more of the load than what it's supposed to be, creating issues in the back. You can also get pain on the outside of the leg below the knee. That's really common because when the hip gets really, really tight, it refers to the outside of that leg, of that lower leg. And a lot of times it's almost like you just want to hit it or scratch it because it's really annoying type of pain, different than like nerve pain. And that it can be a problem. And those are also signs that we start thinking and pulling all the pieces together. I'm like, ooh, there may be a hip issue or definitely a hip component. We find a lot that even if the back is the main source of the problem, there usually is a hip component. I would say like 90% of the time, those go hand in hand. The side of the pain, the back also is the same as the hip on the same side. We have also had people that have only had hip pain and they only feel it in their hip, and it's coming from their back. So again, it's trying to figure out where everything is, but this is in general. If you start putting all these pieces together, you're like, nope, there's definitely a hip component that needs to be addressed. Common complaints that we get for this is sitting and walking gets to be painful. You start thinking, oh, there's a hip component when they're sitting is a problem and walking is a problem. You start thinking that, oh, there might be a hip component. It also can be a back. Like if you're, again, when we were explaining the disc and you have more of that lateral, that herniation that's going to the outside of that disc, not in the back. Those are also really common when you're lying and sleeping and walking and sitting. Like you can't find a comfortable position. You might find it for a little bit, but the pain kind of starts returning. These are again some things that we look at for the back, trying to figure out like, is this something that's coming from the hip, or is this something that's more of a lateral in the back? But overall, common things that you'll find too with the hip is you'll get more pain in the front of the hip as well. You'll feel like you need to stretch, but you can't. It's a common thing that we hear people saying all the time. It's like, I just feel like if I could just stretch it, it would go away, but it never does. It's usually really annoying type pain that you feel when it's something that is going on in the hip. So what about the SI joint? I want to put that in this talk because a lot of times people are saying, "Oh, it's my SI joints out of whack." I used to think that a long time ago when I was a PT because it's kind of what we learned in school. But also, if you look at the SI joint, it is super stable, very, very stable. Rarely do we see issues in the hip. In the SI joint. And so what we do is a lot of times we always start with the back as our first primary treatment, just to rule it out, just to rule it in and rule it out. Then we go to the hip. And if the hip's not moving very well, a lot of times that will resolve all the pain that's even in that SI joint because it's really the hip mobility that's not doing it. Now, is it the hip and the stretches and the joint stretches that we're doing affecting the SI joint? Maybe, maybe not, but rarely do I have to go to the SI joint. If they're still having issues within the hip and the mobility is looking really good, we'll go into doing more soft tissue, but then also looking at the special test for the SI. And in order for it really truly to be an SI issue, you've got to have like 4 out of the 5 tests have got to be positive. Typically, when we see people that truly is an SI joint type person, they're going to be pregnant because you have the hormone that's going to relax all the ligaments so that allows the pelvis to open up, and you'll get some back pain with that. And that's just because the ligaments are a lot more lax, and there's things that we can do to help when people are pregnant with having back pain. Other issues that we'll see with SI joint are people are super, super flexible. So you have someone that's almost like that Cirque du Soleil type thing where they are super flexible. And what we'll find is they'll be super flexible, but there'll be a lot of weakness in that core stability that needs to be addressed that is creating some of that SI joint. But overall, rarely do we find that people have issues within their SI joint. In our office, what typically happens is when they come in, they might have been seeing a chiropractor. The chiropractor's always having to put their hips back in alignment. They come and see us and we show them hip stretches, joint stretches, and how they can maintain this as we're working on some manual work. They go back to the chiropractor and they'll be like, wow, your hips have been staying in place. It's pretty amazing. Yes, because it was the hip that was the issue, not the SI joint with them trying to manipulate it. So that's the caveat on SI joints.